Okay. Well, see, in my office.
Okay, now it's recording again.
Oh, okay. Well, is this okay that I'm in my office? It's kind of,
Yep.
it is?
Yep. It is just fine that you're in your office.
So I shouldn't just turn that off. I wish I could put a picture up.
Well, when we go live, you can just start out and say, you know what, if everybody will just sit tight for just a second, I'm going to test a few things, and then I'll stay on the phone. And if you want to, once it goes live, I can talk to you and say, hey, I can see your screen and I can see you.
Yeah.
And then you'll see if you can see yourself. And then if not, you want to turn off your video, then I'll tell you what it looks like on my end.
Okay. I just want to, yeah. So why is it recording? Can I not turn off the recording?
I don't think so. Because I'm looking on my end. I'm trying to figure out. And I'm entered in as the
admin.
And I don't see where I can turn it off.
Okay. Yeah. Okay. Well, I'm going to let me, I guess I probably should go ahead and start sharing get my stuff up because I want to be ready.
Yeah. And then I am actually, once it gets close to your time, I'm going to go as if I am like to the reception and log back in.
Okay, so there's no, what can you see now?
So I see you, and then I see the first slide with the 4 kids at the bottom.
So you see me.
And then now I see questionable value, blah, 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 blah.
Yeah, and I've got to control her slides, and I'm like, I wish she would just have it come up the whole slide.
Well, take it all up. Oh, well, she's going to want to talk through them all.
Yeah. Okay, so I'm just trying to see. No, see, why does it keep doing that? Hide presenter view screen, display settings. You would think that there would be a thing to like put where I could see myself.
Yeah, because we can see on this end.
And that's what
I swear, I think when it goes live, I think that you can.
You think?
Because he kept saying, oh, I need to turn off my computer, turn off my video, because he didn't want to see himself.
See, I would rather see myself so I could see. I mean, not just because I'm like, okay, what if I make an ugly face or something? I don't realize.
Although I feel like when I do, so I'm actually speaking to your CDHC students tonight, and I feel like when I do that meeting that I can't see myself.
I can't, yeah.
I can't remember if I can see myself or not. And then I feel like when I'm in Teams doing a meeting, I can't see myself either. Like all I can see are the people at the bottom of the screen.
Oh. I'm just trying to get my thoughts together.
So Dr. Grover will probably be logging in hopefully shortly.
I'm hoping.
And then I'll just stay on with you guys until you get started.
So what I don't like is, so like when I'm in this view, I don't have access to like the camera. Like, you can't black or unblack slideshow. Like you would think that there would be somewhere like I would have access to turn on and off the camera.
Yeah, you should.
Yeah, so I don't.
So up there on the top on the, what is that called? Where the internet address is on the browser?
Yeah, there's not, I can't see anything like that. Mm-mm. It's like, if you're presenting in class, that's all you see on the screen. That's what I'm seeing. So if I escape, so then I could turn it off.
Okay, so Rachel's in the session now.
Oh, I love me some Rachel.
I know.
Oh, so she can. So do I need?
Guess she can see us now.
I wonder. I'm gonna text her and ask her.
If she can hear us.
Huh?
Ask her if she can hear us. Oh, she just said I can hear you.
Oh. Oh. Okay, so then I guess I just need to
ask her what she.
Can you? Yeah, talk.
Try it.
I can't hear her.
No, she shouldn't be able to talk. Rachel, can you hear me? It's Jessica.
I don't think so. Yeah, she can.
Oh, how does she hear me?
Because you're on my phone.
On speakerphone?
Yeah.
Oh, I'm on speakerphone.
Rachel, I was saying how awesome you are and how much I love you. That's what Jessica said. Rachel's in the meeting, and I said, I love me some Rachel. So,
hey, Rachel, what do you see on your screen? Crystal and PowerPoint. That's interesting.
So where is Dr. Grover?
She should be here any minute.
But like, where is it going to be me, or is it going to be Dr. Grover that's on the screen?
It should be both of you guys.
Okay. Okay. So I just turned my video off. And what I may do is just introduce myself, and then should I turn? I don't know. What do you want me to do as a presenter? No.
How do you know she's there?
It just popped up and said Dr. Grover entered. But I'm not sure where her video is. Because if she entered, shouldn't she be?
She should be.
Can you hear me now?
Yay!
There you are.
Awesome. How's it going? How's everybody doing?
Good. I can't hear you well.
I can hear.
Oh, okay.
So do I want to share my entire screen?
Yes. So I have the PowerPoint up. You know what, Dr. Grover, I am going to put it in. Let me see if I can. Can you talk again to let me see if I can hear you now?
Sure. Can you hear me now?
Yes, that is good. Yes. Yes.
Awesome.
Okay. So I'm going to share the screen to see. how this works and make sure she can see. Dr. Grover, can you see the PowerPoint that I'm sharing?
Yes, I can.
Okay.
Dr. Grover, can you see yourself?
I can.
See, I can't see you.
Can you see yourself?
Or I can't see either person. I can't see me or.
How's that?
Yep. I mean, you're good. I can't see on my end when I share. Jessica, I wish you could share the PowerPoint, and then that way I would be able to see.
So do you want me to pull it up on my desktop?
No, I can share it.
Okay.
I mean, that's fine. I think we have, so you just let me know and I'll just go with what I.
Okay.
What I have. So
we're ready to start, right?
Just put it on presenter view.
Yes.
Now, Crystal, will you be advancing my slides?
I will.
Okay.
All right, you good, Crystal?
Yes, I think I am good.
Okay, I'm on standby.
Okay, thank you. Okay, Dr. Grover. You just let me know when you want me to advance.
I'm ready. Oh, well, why don't we go back to the opening slide and I will just start again. And I want to thank everyone who is joining us today. My name is Dr. Jane Grover. I am a Michigan dentist, Michigan grad with a dental and public health degree. Before joining the ADA 7 years ago as the director of the Council on Advocacy for Access and Prevention, I was an FQHC dental director for 12 years at the Center for Family Health in Michigan. Prior to that, I was in private practice. So I've worn a couple different hats over the years, and I'm delighted to talk to you about the CDHC, the Community Dental Health Coordinator Program. What you are looking at here is what we call the logo. And you can see that the top 3 areas of priority for the CDHCs are to connect people to care, to educate them, and to prevent disease. This is a dental case management program for dental professionals. Next slide, please. So if we ask ourselves why oral health disease is so prevalent, particularly in certain populations, and why is untreated dental disease such a normal finding in many elementary school children in particular? Why is there a gap in the understanding between the physicians and the dentists about what oral health communication can be done to effectively get children in care, get families in care, keep them in care? And as a former FQHC dental director for 12 years, and I'm sure many of you have this experience as well, people will wander in and say, wow, I didn't realize there was a dental clinic here. I've been walking by this place. I'm sure that there are dental schools that are experiencing the same, gee, I didn't know I could get care here type of situation with patients who really need care. Next slide, please. So in the medical world, the Journal of the American Medical Association had a commentary several years ago that talked about patients needing more than just the care itself. They need help with social problems, connections to resources, transportation, and translation of the increasingly complex language of medicine into terms they can understand. Well, that's health literacy. And in the dental world, we know that literacy is an extremely important barrier that educated people face. I mean, how many people really understand what a pulpotomy is or what periodontal disease is? So we realize that there is a gap in patients understanding the jargon and the appointment times what's going to happen at those appointments. These are aspects of the CDHC program which are so important, and that is why the program was developed to begin with. Next slide, please. So the ADA years ago looked at the value of community health workers. Now, community health workers are trusted members of a community. They build health capacity within a community, and through outreach and community education, they actually have improved health outcomes remarkably, decreased use of emergency departments at hospitals, and improved patient compliance with preventive measures. In the dental world, we don't do that. In the dental world, we hand people sheets of paper and we say, call one of these numbers, or here's your treatment plan, here's what's going to happen next. We don't take the time to really verify that people understand what we are talking about. Next slide, please. So years ago, the ADA asked the question, what if a dental provider, what if a dental professional like a hygienist or an assistant had that skill set? What if we moved beyond waiting for the phone to ring, for a patient to request an appointment? Maybe they don't know what they need to request. Maybe they don't even know when they need to request that appointment. What if we had a skill set that worked as a demand aggregator for patients who need care but just don't know how to access that care? Next slide, please. So the CDHC program was designed, it's licensed and trademarked to the ADA, and this is a program that teaches case management. These are community health worker versions, dental versions of community health workers. They do care coordination, they do patient navigation, and as allowed by a state practice act, they can do selective preventive services. What does that mean? That may mean spending a couple mornings a week in a pediatrician's office, applying topical fluoride varnish, and navigating that family into a dental home. Next slide, please. So why are dental professionals so essential in a dental case management program? They understand the dental disease process. Now, many times case managers are called care coordinators, or they are in a health center and they are case managers, but they don't know very much about the dental world. Dental professionals understand the terminology and the jargon. They understand how the dental appointment process works, and they know how to explain that in plain language to patients. Again, we are currently not doing this very well in the dental world because people are patients we are depending upon to self-educate, self-navigate, self-facilitate. In the medical world, they've seen some impressive outcomes with case managers. So we developed a program for dental version of case managers. Next slide, please. So CDHCs navigate patients into existing care, which is underutilized or has excess capacity. What does that mean? Well, the Chief Dental Officer of the Health Resources and Services Administration told me earlier this week that community health centers are down 30% in their encounters for this year. So the CDHC program can be very beneficial in this regard, getting people into care that need care. And the CDHC program consists of online modules, which are supplemented by Zoom or Skype sessions. And I'm delighted to present with Crystal Adams from Catawba Community College, who is running a wonderful program at her institution. No irreversible procedures, and CDHCs can help you fill that partially filled appointment book. So at the ADA, we have a Health Policy Institute, and many of you are familiar with Marco Vujicek and his wonderful data that he presents. And I will share with you that dentists have told us that they are having a lull in the schedule, that the schedule isn't as filled as they would like it to be. And our friend Ann Bottrell, who is the executive director of the American Dental Hygiene Association, tells us that the number one issue of hygienists in the country today, the number one issue is doctor can't fill my appointment book. Doctor can't fill my schedule. So why do we expect dental professionals to sit in an office, sit in a silo, and wait for the phone to ring? Next slide, please. When they can be out in the community doing some amazing things. We know that if we guide the patient, if we guide the family, we guide the treatment. Handing out appointment cards or sheets of paper that say, here are the dental resources in your county, is not going to get that patient into care. Next slide, please. So what is contained in the online modules of the CDHC program? Oral health literacy, an understanding of the social determinants of health. Community mapping. What does community mapping do? Community mapping helps you find the stakeholders in your community that want to support your oral health efforts. Why is this important? Because we know that only about 60% of people with commercial private insurance actually utilize it. And employers are looking for that return on investment. They want a healthy workforce. Motivational interviewing helps you establish effective communication with patients. We have to go beyond handing people a copy of their treatment plan saying, okay, we'll see you next month for your filling appointment. Next slide, please. The modules also cover topics regarding human behavior and health and client-centered counseling, public financing of dental care, and risk management. Why is risk management incorporated into this? Because patients who struggle with health literacy cannot sign a consent form that they cannot understand. So this is where this program, offered over an 8-month period of time, does a very deep dive into this particular topic as well as the others. Next slide, please. So where can people with this skill set absolutely shine? FQHCs, hospital EDs, senior centers, and Head Start, also in private practice. Again, we know that many dental offices have open schedules and they've got a lull in their bookings. Why not have some dental professionals who have done this training, who are on your staff? Why not have them go to pediatrician offices, go to senior centers, go to Head Start, go to the teachers' meetings, and do an oral health promotion on why it's essential as part of overall health? And this is how you can fill your appointment schedule. Next slide, please. So we all know this unfortunate condition. We all know that attached to this little person is a mom who will say, nobody told me juice in a bottle was a bad idea. Nobody told me chocolate milk wasn't great to put them to sleep with. And so who in the pediatrician offices, who in the family practice centers are helping with oral health education? Next slide, please. So what are we hearing from some of the 600 plus grads that we have right now? Career flexibility. We have some grads who were hygienists, who were assistants, and through a variety of reasons, for health reasons, they are unable to practice. They are unable to use their hands as they once were. And so what they have done is they have found positions and opportunities with agencies where they are utilizing their dental knowledge and utilizing their ability to navigate patients into the dental world. But they don't have to see patients in a clinical setting and perform that type of encounter. Next slide, please. We all know that a young mom of 3 kids, I remember this young lady very well, handing her a sheet of paper and telling her to call one of these numbers is not going to help her become a confident consumer of health information. It is not going to help her navigate her family through the healthcare world and keep them healthy. Next slide, please. This is the medallion. This is a certificate of completion that the programs offer. There is no change to a State Practice Act. There is no change to licensure. The CDHCs are dental professionals to begin with, and they remain dental professionals. They are still hygienists. They are still dental assistants. This medallion tells you, and it's transportable to all 50 states, by the way, This tells people that they graduated from the ADA program. Next slide, please. So we've seen some new job opportunities, and I'm happy to update you on what we've seen. This job opportunity came from a Florida newspaper, an oral health navigator. And you can see that the oral health navigator is responsible for outreach, scheduling, and help with scheduling appointments, management of related participant and family activities. You'll note that there's no language here that talks about how many patients you have to see per day. Agencies are hiring people that can address overall health, but they have to have an oral health knowledge base. That is a valuable commodity. Next slide, please. This is from a Michigan newspaper. This is for a preventive coordinator to oversee group homes and patients with particular dental needs. You'll notice that the language of this contains no description or productivity. How many patients do you have to see per day? This is about navigating patients and coordinating their care. Next slide, please. We've also got a Tennessee group that hired 4 people that have gone through the program. They've navigated over 2,500 seniors into oral health care. That's 2,500 seniors into oral health services. They got a large grant, I would call $12 million a large grant, and they are using that grant as described to navigate those seniors into care, keep them healthy, and have them be confident consumers of dental information. Next slide, please. Now, this is one from a New York FQHC. This was posted in March. This CDHC will be performing non-clinical case management, again, valuable dental knowledge, and she is going to be the point person to navigate patients from the medical side to the dental side. She is also the facilitator between the hospital emergency department and an oral surgeon's office. So she's wearing a couple of different hats. She was on our CDHC transition team call a couple of weeks ago, and they absolutely don't know how they ever lived without her. Next slide, please. So this is from a dentist in Vermont who talks about the biggest problem we have is making the connection between the people in need and their ability to navigate the system and get access. If you have a person or two in your office who can go through this program and be your liaison to the community, to the outside world, you can't imagine the number of new patients you will get and the number of patients that will come to your office rather than the hospital emergency department. This social service component is essential, and it has worked especially well at our office. So says Dr. Celine, who's the director in Vermont. Next slide, please. Case management codes. Let's talk about these. These are dental case management codes. They were approved by the Code Maintenance Committee, and that is the group that puts those codes into the ADA CDT code book. So there are 4 case management codes. You can see the D9991 and the D9992. You can see the descriptor there. And the next slide has the other 2 case management codes. Next slide, please. Thank you, Crystal.
Welcome.
So here is an overview from the Association of State and Territorial Health Officers. And they are outlining the states where the dental case management codes are paid to some extent. Not all of them, but some of them. So this is a start. Again, in the medical world, the case management codes are covered. They are reimbursed by insurance. That is how case managers get paid. In the dental world, we don't have it yet, but it is certainly on the radar of CMS. And in fact, some of the HRSA grants that we've seen over the last several years actually work towards gathering the data to support payment for these codes. So we're building our case. Next slide, please. We have to recognize that part of the dental value, part of the oral health world is outside of the operatory. And as third-party payers move from volume to value, dental professionals will be compensated on a variety of things, not just on the procedures that they are doing. But by the way, who can do procedures if nobody's coming into your practice anyway? Next slide, please. So update right now, we've got 19 schools with the licensing agreement, preparing or currently offering the program, over 600 grads with almost another 300 enrolled. Essentially, we've got a school, a graduate, or a trainee in 45 states. One of the challenges that we embrace is educating our dentists, educating the state associations about the value of this, because if patients who need care are unable to get that care because they don't know how to access a dental care system, they don't know how to proceed through it, and they are unaware of the details of how to maintain that oral health, then we're like one of those little hamsters in a cage. We're doing the same thing over and over again, but we're expecting a different result. Next slide, please. So I've given you a lot of information. I'm sure you have questions. You can ask questions at the conclusion of our presentation, but you can email me at any time. And I'm delighted now to turn things over to Crystal Adams, who is the director at Catawba Community College, who can talk a little bit more about what she has seen trend-wise with the groups of students that have gone through the program. Thank you very much.
Thank you, Dr. Grover. If everyone will just give me a quick minute to switch over my PowerPoint. Hello, everyone. My name is Crystal Adams, and I'm the director of the Dental Hygiene Program and the CDHC program in North Carolina, one of the programs. And so we're going to focus on North Carolina and what is happening here with the care coordination model. So as I mentioned, this program is held at Catawba Valley Community College. It's located in Hickory, North Carolina. Anyone that wants to attend the program, it's a completely online program. And so you do not have to travel to Hickory. We have many graduates from our program that's from other states. We've had Idaho, Ireland. There's many people. Now we can educate anywhere. The program is an 8-month program, and it only costs $180. So that's the total cost. It does not, you don't have to purchase any textbooks or anything. Dr. Grover mentioned in one of her slides the curriculum, and so I'm not going to read every one of the modules that you'll go through in the program. However, I do want to highlight that in addition to the modules that the CDHC program offers, we also have collaborated or connected with the oral health section, and we're allowing people to take the North Carolina Public Health Hygiene training in addition to the modules. So that is part of the curriculum whenever you come to CVCC. So I want to talk about some students in our program and what the experience is, and highlight the experience that several of our students went to UNC and ECU. And we felt like this would be a great internship. Honestly, I think the students wish that it could have been longer, but we worked with Dr. Moss and we worked with Dr. Weintraub, and the students went to work with the pregnancy population in their pregnancy clinics. And while they were there, it was highlighted that, you know, these care coordinators, CDHC students, could do so much more in helping the patients understand. And we're going to talk about the education. You know, we go to school as dental providers and as a dental hygienist, a dental assistant, and, you know, we learn about education. But the CDHC program expands upon those skills and offers motivational interviewing. and offers a lot more in depth, and we'll talk about that. But this was a highlighted experience. If you ever see Marianne Yance, Barbara Smith, any of these individuals, they had a great experience. And I think the dental schools, or I don't think, I know the dental schools were very surprised at what a CDHC could do for the dental community in North Carolina. In addition, Dean Chadwick, I heard, said he would love to have, and then he would love to employ several of these CDHCs in the future. You are required in the program to do a project, and these are community dental health projects. And some of these projects can take place at your work in collaboration with outside organizations. Some of the projects that I would like to highlight is with nursing homes, people who's worked with the special needs community, Salvation Army, and then a lady fair. So this gets you out of the dental office. Dr. Grover spoke in her presentation about getting out of the operatory. We have to meet people where they are. Also, with the school-based programs that's occurring or that's being set up in our state, you have to go to these individuals so we can educate them so they know their dental needs. So, as Dr. Grover stated, once you complete the CDHC program, you will get a certificate of completion, and it will have the ADA medallion on it. In addition to the certificate of completion with the medallion, you're going to earn 80 hours of continuing education. So that's a lot. It's way over the number that you need for North Carolina, but we want to give you the continuing education for working in the program. I want to highlight a former graduate of the CDHC program, and many of you may know her. Her name is Marianne Yance, and she works with Cabarrus Health Alliance. And I wanted to talk to her about her experience and what she felt like she gained out of the program. And she said the advantages of the program were that motivational interviewing. And a lot of people are not familiar with motivational interviewing, but it teaches you to meet the patient where they are. It teaches you to have a conversation with that person and learn about that person. And she said, even though she had went to dental hygiene school, she had worked out in the dental community for many years, it opened her eyes at how to meet patients where they are, how to talk to patients. In addition, the community mapping that Dr. Grover mentioned earlier, she said, it was really interesting to actually dig in and look at her community surrounding her, because that's the goal of this CDHC program, is to provide graduates in the communities where they're from so they can reach out to the communities that are in need and help them improve oral health care access. So she said it was very interesting, even though she's a public health hygienist, to really do this project. In addition, she said her experience at the UNC Chapel Hill internship with the pregnancy program was phenomenal. She got to learn a little bit about teledentistry there. And the opportunities that she's had since she's graduated this program have been phenomenal. She said, they've called her and she's actually set up a teledentistry program at Cabarrus Health Alliance. Some of it was because of COVID-19, but she said the skills she learned in the CDHC program at CVCC enabled her to be able to set up these programs, in addition to talk to her patients in a different way so they understand the importance of their oral health care needs. There's been other opportunities that's opened up for her due to COVID-19, but she said those skills were learned she learned those skills while she was in the program. She said had she not went to the CDHC program, she does not know if she would have had these opportunities. So care coordination in North Carolina is definitely growing, being studied. The North Carolina Oral Health Collaborative, which I'm sure everyone is aware of, released an article, an intro to community care coordination, and they were looking at navigators. They're looking at CDHCs, and they're going to be releasing other information as they go through while they're studying this. Parker Norman is an intern, and she actually stated in the article that she talked about improving access to care and promoting that oral health care literacy. So we know a lot of our patients, they think, okay, I need to go to the dentist, but why do they need to go to the dentist? They don't have time to go to the dentist. They don't have the funds to go to the dentist. So this CDHC individual, the professionals, they can help them. And a lot of times they're going to be from that community that they're working in, so they can actually speak the native language sometimes. They know the communities, they're connected in their communities. And if we connect these CDHCs to the patients, then they're going to be more likely to seek and utilize oral health care, as Parker stated in this article. In addition, they talked about how it's going to be important to consider these different models. We've always thought, okay, we go to a dental office and we wait for the patients to come. We have to meet the patients where they are, especially if we want to improve the oral health care for all North Carolinians here in our state. In addition to Marianne and highlighting what the North Carolina Oral Health Collaborative has been doing in North Carolina, Dr. Donegan, I'm sure a lot of you know him. He is the dental director over at FQHC in Gaston County, and they have been doing phenomenal things. And he is definitely a supporter of the CDHC model. Actually, currently he has some of his employees that are going through the program at CVCC. And in talking with him, he stated, or he mentioned several things that resonated with me, because he said, you can't use the concept, build it, and they will come. We can't, as Dr. Grover stated, we can't sit in our dental offices and say, okay, when the patients call, we'll get them in. We have to meet them. We have to educate them. And that was another thing that Dr. Donegan said that resonated with me. In real estate, it's location, and I'm using his words. In real estate, it's location, location, location. In dentistry, it has to be educate, educate, educate. If our patients don't know what they don't know, they're not going to come to our facilities. So with this CDHC model, the ADA has created an atmosphere or a profession that we can think outside of the box, and we can collaborate. If public health, local health departments, FQHCs, and schools, if they connect, we can provide a stronger network for oral health care in North Carolina. Some of the things that Dr. Donegan is doing at Contegra Health is, they use a team-based concept. So they're using the dentist, they're using the dental hygienist, the dental assistant, but they're also using that care coordination, the CDHC model. And he said, in order to connect with these outside organizations, maternity clinics, pediatric practices, medical practices, he says, we're going to need these CDHCs, because it's important to make sure that we help these organizations understand what their citizens need. In addition to Dr. Donegan, he is using teledentistry. And as we're incorporating teledentistry, and we're going to more and more in North Carolina, I feel like it's going to be important that we have an individual that has dental knowledge and also has these motivational interviewing skills and these community mapping knowledge of their own communities to talk to these individuals to get them the care that they need. I reached out to Dr. Parker because I feel like that he is as everyone probably knows in North Carolina, he's the North Carolina Dental Society Executive Director, and he is very much in support of community dental health coordinators. And he released this statement to me, and I just wanted to highlight, he said, many of the barriers to achieving the goal can be overcome by adding this CDHC to the traditional dental team. So again, I want to go back to Dr. Donegan's statement about saying, let's think outside of the box. Let's change dentistry and get people the care that they need in North Carolina. Because, as Dr. Parker stated, CDHCs are uniquely qualified to assist and educate patients in regarding various dental services and protocols available within their own community. So, North Carolina is definitely looking to expand the CDHC model. In addition, I just want to let everybody know that the CDHC program is designed to accommodate working individuals. There is a prerequisite to to be a RDH, a CDA, or a dental assistant too in North Carolina. And the reason is because you need to have that dental foundation. You build upon those skills with the motivational interviewing and all the models in the CDHC program to add to your skills to become the professional that can work with these communities. And, you may be working with superintendents. Right now I'm working with Alexander County Health Department and helping them with a school-based program. And it's going to be essential to get a CDHC so that way we can make sure that the care is given to the individuals. You can't just say, okay, I've seen this patient, I'm going to tell them to come back. They don't understand that. You're going to have to reach out to parents. You're going to have to reach out to all your partners in your community in order for the citizens of North Carolina to get the care that they need for oral health. In addition to the program, there's monthly meetings that we hold in the program. Also, it's for we have flexible scheduling. People can work full time and go to the program. We are offering a program that starts October the 29th. Registration is now open. In addition to our program, I do want to let you know that the CDHC program is offered at Alamance Community College. So Dr. Grover has worked with North Carolina for several years now and helped us create a strong program in order to get these CDHC individuals and professionals out to our community. If you have any questions about what's going on in North Carolina with the CDHC model, please contact me. Again, I am the program director. If you want any information about the program, you can contact me as well. And if you want to register, you can contact Donna Davis. So I'll show you my references and we can open up the floor now to questions so we can provide any answers to you that you may have.
Will they type in the chat box?
Yes, I believe they will type in the chat box, and I am trying to get out of my screen right now.
And Crystal, we want to let everyone know that Catawba will be starting another program on October 29th.
Yes. That and registration is now open. So yes, we are. So I don't see any questions at this point. Maybe that's a good sign that we covered everything.
And it is an 8-month program. So they will start in October, end of this month. And part of the curriculum, the program involves a community demonstration project or an internship. And we have seen some fascinating ones. I want to share with people that a couple of those have evolved into HRSA grants. Health Resources and Services Administration took one CDHC in Alabama, took her application, turned it into a 3-year, $250,000 HRSA grant. And we have an article that will be published later this year about the good work she is doing there with the University of Alabama. So if there is anyone here from UNC, I would think you've got some golden opportunities to get a couple folks in the program. 2x2 is a great way to have a study buddy. This is a college level course. It is not leafing through a few articles on the weekend. We have found that students, Crystal, correct me if I'm wrong, but some of the students say it's about 2 to 4 hours a week of reading and studying. But the material is so fascinating that it's really enjoyable.
You are correct. So about 2 to 4 hours a week. And, a lot of people have questions about the internship. I like to call it a project because it gives you an opportunity to work with partners outside of, you can work within your place of employment, but it gives you an opportunity to work with partners. And it also, you don't have to be there 24/7. You can still work full time. But part of this project is about you looking into your community, what services are available. So that is included in the internship and is counted as part of the hours. So whenever people look at the internship and see 120 hours, a lot of them think, oh, I can't do that. I don't have the time. but it's more of the research of your community, understanding where you live, what needs exist, because if we don't fulfill those needs, they're never going to get met. And so we as dental professionals are the perfect individuals to help our communities. And right here in North Carolina, it is happening. Dr. Donegan is a great example of that. I'm very excited about the project that CVCC is working on with Alexander County Health Departments because we have to increase the care that our communities get for oral health care.
And if people want to do the program, but $180 seems like a lot, we can have some tuition assistance for you. So please don't hesitate to reach out and let us know if you need tuition assistance. We're happy to help with that. We're also happy to help with you throughout the program. There are people that need supplies for their internship or their community demonstration project, and we are happy to assist with that. And we're just so amazed at the innovation of some of these community demonstration projects or internships. It's really remarkable what people can accomplish once they get out into the community and see what the needs are.
Yes, and dental hygienists and dental assistants in North Carolina, there's a lot of opportunities, especially right now, because this is new in North Carolina and it is gaining momentum. We are seeing that access to care is very important. I know Rachel Stewart's in the audience, and she is probably one of the people that can tell us what our communities need. She is actually working with ECU in a school-based program, and she can tell you how important that care coordination model is, and to make sure that you follow up with these patients because they get busy. Dental health is the last thing on their mind. So it's very, very important. And it's not just it could be our friends that we're helping. So I just had an experience with a good friend of mine, and she's very knowledgeable, very intelligent, but she doesn't have that oral health literacy. And a care coordinator in the school systems, which is what we're hoping to get in North Carolina or in Alexander County, a CDHC to help connect care for these school-based children. That CDHC is going to be the person that holds a school-based program together.
And if people are engaged in a project as they go through this program and they want a letter of support, we're happy to accommodate you on that as well. So that's how strongly we believe in this program, the value, the opportunity that people have with this. And the opportunities are pretty remarkable when you get out and engage stakeholders who will come up to you, people that you may not even have been aware of, that had oral health on their radar. And I'm thinking of the hospitals as well. Hospitals every 3 years by law have to do a community needs assessment. Mm-hmm. And oral health is within the top 5 or 6 items that the community needs assessment indicates. They're going to need somebody like you, somebody that has that skill set. And so this is another opportunity where we can engage the total health of the patient, not just what dental procedures are we doing, but we're engaging the medical community as well.
And that's what's so amazing are the opportunities out there. But you can't think in the old way. I go into a dental office, I see my patient, they come, they may not come. You can't think in those old ways. And I wished everyone could hear the excitement when I spoke to Marianne Yount, one of our former graduates, about how the CDHC helped her. She was she's a public health hygienist. She's been in the field for many, many years. And she was like, oh my goodness, it helped me so much. I mean, it really opened her eyes. And I've had other students tell me that cultural competency, understanding where people are at the moment. Dental hygiene school, it does prepare you to treat patients' oral health care, but it doesn't provide you with the skills on how to talk to that patient, how to meet that patient where they are. It's so much more. You can expand yourself with this program, and you can expand your knowledge, and you grow as a professional. And it's amazing how it can really open your eyes to communities that you've never thought about before helping. So, if you want to have an opportunity to think outside of the box and pave your way as a dental professional, this is an opportunity that you can work with a dentist. I want to make sure, definitely work with a dentist. We work within our laws. We do not go outside of the scope of practice for dental hygienists or dental assistants in this state, but it gives you, there's opportunities out there that we can work with the dentist and provide exceptional service. Do we have any questions? If you have any questions, please feel free to put it in the chat box.
Mm-hmm.
This is very new. And when I first learned about this, when I first heard about it, it's been 3 or 4 years ago now. It was like, what can they do? And wow, the things that have occurred since then. I started with Alamance Community College teaching this. I've been working with Dr. Grover for many years now, and it's been amazing. The results we've seen, we're actually being able to highlight care coordination CDHCs in North Carolina. So I'm very excited for the future of this program and how it's going to help, many communities in our state.
Mm-hmm.
Okay, Dr. Grover, I think
we did a great job.
Yes. So, and they can contact you or myself, and we will be happy to give them any information in case they don't want to ask a question here today.
Right.
So this has been wonderful. Thank you so much,
everyone.
I appreciate the oral health section in North Carolina inviting us to speak today.
Thank you, oral health section.
Thank you.
Thanks for everything you do.
Bye.
Bye-bye.